Portsmouth Hospitals NHS Trust. It's a large organisation serving a population of 650,000 people. We employ 6,000 staff, we have approximately 1,200 beds, and we have a turnover of 440 million. So like many organisations in the NHS at the moment, we are a challenged organisation financially. We have a number of work streams designed to help us take out the cost, with a specific focus on non-pay. We see this project as a mechanism to help us reduce our costs, which then means we don't have to reduce our staff costs as much.
Previously, we had a theatre store where any clinician could come in and take whatever they needed when they needed it. My team were then replenishing the shelves, so it was a total reactive service. Now, with Microsoft Dynamics, we've shut the door. We don't allow people just to come in and take what they like. We've agreed with them what they need up front, and we deliver the stock at the point of use. So with the same amount of staff, we are now providing a far more proactive service by delivering the goods to the theatre. Clinical time's been freed up and back to the front line where it should be, and everybody's a winner. We had stock levels set against what we believed we would need, and we would replenish to that level. However, now we can actually see true usage and then run an optimisation programme to look at what our levels should be.
We've consolidated stock items from around the Trust, and now we can actually use that stock, and that potentially means that over time we can take out between £1 and maybe £2 million worth of stock that we've currently got on the shelves and not have to replace that because we've overstocked. That's a real opportunity for any trust.
A lot of reps would come into the NHS because they did see it as a cash cow. They could sell to a surgeon, the surgeon will bring that product in, and then next minute you've got X amount of stock sitting on the shelf and no one really knew about it. Now, with the system, there is a process you need to go through, which is the procurement board, and then see whether it's a clinical reason we need it or a financial reason, so there's more control and visibility of anything that's coming in through our complex.
It allows us to go to market with very good data and be able to commit for the first time genuine values and volumes that end up allowing us to contract in a very informed manner.
To have real-time information as to what is actually used in theatres on a particular patient can actually really help you therefore plan for the future. Now we can give a clear volume understanding to the suppliers and get both the best price but also good delivery of equipment when we need it.
We're dealing with people, and you can't have it's going to come tomorrow. It's got to be there today because your patient's on the table today being operated on.
Occasionally you had to cancel something because a product wasn't there. So now the system is ensuring inventory is ready for every procedure at any time of the day.
If you got stock that's been sitting there 2-3 years, if it was an out-of-date product, if there was a mistake, it could have ended up on a patient or in a patient, which is even worse. So straight away that is a huge benefit.
We've had a few difficulties with people trusting in the system. They believe they knew better as clinicians what products they need. However, we've built confidence now and people have come along with us and they're seeing the benefits and the relationships are a lot closer and we're working together. My team haven't just learned a new inventory management system, they have learned true stock management skills. They're far more confident and their skill base has just really grown. And now the service we're providing is really something else.
The project was very much based on providing a return on investment of probably 3 to 1, and when we actually got into the numbers it very much allowed us to provide a return on investment that was significantly higher than the original business case.
For me, working as part of this project team has been really good fun, hard work, but I've really enjoyed working with such a company as Smart Use.
They had to tread very carefully as an implementation team to come in to actually get these clinicians on board, which they did. And their openness, their friendliness, and their drive and their commitment to deliver, I've not seen before.
I believe the hospital's made a really good investment. We are truly managing our stock.
It's the best thing since sliced bread. It's something that has totally changed the way that we work.
The whole of the Trust and any other hospital trust could do this. It's fantastic for the taxpayer who are funding it.
One of the reasons I'm really committed to this and I feel really passionate about it is because it's enabling us to take out cost, but not to the detriment of patient care.